beautiful patient. She's actually like honestly one of the strongest women I've ever met because she did filler. We just did not only for acne scar filler, we also did pan facial rejuvenation with biostimulators like Sculptra and Renuva. We're all now doing full CO2 for her acne scars, but also anti-aging. And she's a darker skin tone with a little bit higher risk of hyperpigmentation. So we're being a little cautious with our settings. She's going to be very, very detailed when it comes to our aftercare protocol. You guys see over here on the left, our Emer Skin Hydration Mask. We're going to put on immediately, just kind of going through some of the areas that she has scars.
And then our Hyla B and our AOXC.
You guys know there's a like the holy grail combo to keep the skin, I don't know, my estheticians say like a drink of water on the skin because it helps it hydrate. Now you guys see we just did the full face, and AOXC is my favorite because it's a vitamin C.
These have been our fan favorite since the line was launched years ago.
Yes.
These two have been my favorite products.
And my patients love it because it actually acts kind of like an oil. It helps really soften the skin.
What makes our AOXC different from other vitamin C's?
Well, there's a lot. It's a different type of vitamin C that's more strong. It's a higher strength vitamin C that you'd be surprised doesn't cause any irritation. And it's clear, which is very strange compared.
I'll show them right now.
Yeah, you can even put a drop on there. It's fine. Sure, drop.
Drop.
Look at that. It's clear, and I'll show you guys. When it goes on, it's like an oil.
And you can look at that skin versus the skin that didn't get it.
Look at the CO2. She's actually doing really, really well. It's tightening up. But again, you see, like, even this old scar she has some hyperpigmentation in it. So you want to be just really cautious.
Someone asks, what's the downtime for a CO2, Doc?
Usually about 5 to 7 days of kind of peeling and aftercare, and then another 1 to 2 weeks of some redness, depending on your skin tone. Her skin tone tends to get, look really good immediately, and then a week or two later, it can look a little darker, but then with the skincare, it brightens up, and it looks more normal in a couple weeks, So it's just, as long as we can follow the skincare protocol, everything's great. We have protective eye shields in there by Innovative Optics. I have those as well on my eyes. My favorite. You guys love my magenta pink, the best. All right, again, and I'm going right up to the lash line. You guys see.
Someone says this is the best treatment for lids.
I mean, honestly, so many providers do way too much when it comes to filler. And again, most of what people need is textural and tightening. And so I would say less fillers, more laser and tightening, and biostimulators like we just did, our Sculptra Renuva combo. And then again, people have festoons, they start to lose, they get kind of puffy, and they get wrinkles under the eyes. So we're going all the way out to the crow's feet and getting all the way up to the lash line. She's doing amazing. She has nerve blocks in here, and she has eye shields again from Innovative Optics. We'll tag them so you guys can make sure you learn about the best company for eye shields if you're a provider out there. Obviously, you'll learn much more like this if you go to Emer University. We do training, and she's going to use all my Emer skin products and our protocol because it was designed actually for darker skin tones.
Someone wants to know, can this be done for lip lightening too?
Not this laser actually, but we could do a tattoo laser, and we can also do, that's usually our Pico, sorry honey. So I do a little bit extra on the upper lid, just for the pigmentation, be a little cautious. And then again, going a little bit closer to the lash line.
Would you do this on a skin type darker than hers?
Yeah, it just depends. We'd have to prep her and just see how she looks, but we've done it before, as long as everyone understands sort of risks and stuff like that. So now I'm just looking to see if she has any specific scars that I kind of want to doubly treat. And I'm looking around, making sure everything's blended. Because this is where most of her scarring, she has textural throughout, but I'm kind of blending everything. And I'm just looking, she had a couple kind of on the mouth area here. I'm just blending. And And this is called feathering, you guys. And there's a newer version of this laser called Alpha that does very quick blending and feathering and a very high sort of pulsing. Perfect.
Got another question. How many sessions do we normally need to see the results?
Well, you can see a result in every treatment, usually depending on skin tone and how deep the scars are. But I always tell people 2 to 3 sessions closer together, and then you maintain from there. You're always going to need to do something to maintain and keep the skin looking good.
It's like working out, guys.
Yeah, if you stop, you lose it. All right, so that's it there. So now we're going to get her cold air, and we're going to put on our healing protocol, which is going to be really important to get our, first I want to get the shields out. So we'll get these out. Hold still, just keep your eyes closed. She's got a bunch of stuff in there to protect her eyes. So we'll wash her eyes out in a few minutes. But the key right now, you guys, is get her cooling down. So let's give her the cold air. And if you guys can give me this, the PRP and some of the products. Daisy can give me the products. So I'm gonna put the PRP with our stem cells and exosomes on. And then can you just drop a few? Just don't touch the skin with the dropper. Now she's gonna put first our Hyla B. This is our hyaluronic. Very important to get on there. Beautiful. Perfect. Obviously at the same time we're doing that. The second is gonna be our vitamin C. Perfect. And that's more oily, although it's not an actual oil, sort of acts like it. And then she's gonna feel a little wet. And this is
You talk about how crucial it is that patients follow the skincare routine while they heal.
yes, and here's the thing. I've had people yell at me because they think I'm trying to oversell them stuff. I'm like, listen, I've done this for so many years, you guys. If you don't follow those protocols, you can't go this strong. And if you can't go this strong, you can't get as good of a result. And the problem is then you get hyperpigmentation and other issues. And on her skin being darker, we need to make sure we prevent that or limit that as much as possible. I would love to go even stronger. You give it to her.
There's a reason you're famous
But
for
I
your
can't.
results.
We just showed those. We just put those on, which is great. Yeah, we already did it. She was great. And then she's gonna use that cold air on your face, okay? And then I like to squeeze out. You might get a little bit in your mouth. I always tell people just keep it closed. I'll wipe you. Don't worry. And I don't care if this gets everywhere because I just want this all over her skin. This is our combination of our peptides, hyaluronic acid, growth factors, and we have a couple other masks coming out soon for acne and brightening. And then we have a stem cell mist that we would put on right now as well to help her heal. So you guys will see I'm gonna cool her down. She's using the air. We're gonna red light her. And there's a bunch of other things we do in our aftercare. And throughout the week, we'll take pictures and get some updates so you guys can see what it's like for a darker skin tone to get laser in all these areas, okay? How does this feel? You okay? She's doing great. So just a few more minutes. Swelling will go down over the next hour and she'll be fine. And she'll have scabbing and peeling over the next week, but with the skincare products, she will do great. Bye guys, have a good day.